Hello, everybody, and welcome back to the Ketodontist podcast. This is your host, Dr. Matthew Standridge. I am so happy that you are here today. So I know that it's been a while, and I do apologize for that. Things have been kind of crazy the last few months, as you can probably imagine. I hope you're doing well with everything going on, all the craziness with the COVID pandemic and all that stuff, and we've been a few months into that now. Before we get started, I figure I'd give a little bit of, since this is also kind of my personal journey as well, I figured I'd give a little bit of an update there. So it's been rough these last few months, and I'm not gonna lie about that. So March 16th, I had to close my office, and we ended up being closed for a few months. And that really set us back because I am a practicing dentist. I work full time. I run a business. I manage about 1,600 active patients. We do a lot of advanced procedures. I manage a team. We run payroll, pay bills, all that stuff. So I'm not trying to be an influencer here in the fact that this, I spend tons of time on social media. I'm busy being a family man. I'm busy being a doctor and a business owner. So when my office was shut down for 2 months, that's tough. And I was dealing with quite a bit of depression, not only because of the business, but even bigger because of that. March 16th, I had to let all my team go. And then 5 hours later, I am taking my wife to the ER because she's having a miscarriage. And so that was a very, very tough day. And I still get a little misty-eyed thinking about it. And so in a way, the quarantine was a blessing because it forced me to deal with it. It forced my wife and I to come to terms, to deal with some things. And it hurt even more because we've been trying to get pregnant for over 2 years prior to that without avail, and found out she had basically a cyst on her uterus that wasn't allowing things to implant. So she underwent surgery back in September to have that removed, and she did. And then come January, after we were okay to try again, boom, we get pregnant, and then, or February or whatever, then a month later, we lose it again. And then just this last couple weeks, we went to have it reevaluated, had a new sonogram, and the cyst is back. And so we came to the decision that we're done. We're done trying to have kids because we can't put her through another surgery. We can't afford another surgery. They quoted us $90,000. Luckily, we were able to, because we were paying cash and it wasn't covered by insurance, we were able to negotiate that down. But still, we can't go through that again. And so maybe down the line we'll look into fostering or adopting. We'll see. But having kids naturally is no longer in the cards for us, and that was a big blow. And so, quite honestly, the last few months of dealing with depression and stress around all of this, podcasting was not high on my list. Let's just say it that way. And moving forward, I am getting back into podcasting. I actually have some great interviews getting lined up, some great guests coming on that I'm really excited about. Speaking of, the girls are awake, so if you hear Hazel yelling upstairs, my apologies. I usually try to do this early in the morning before anybody else is up, because I'm the early bird of the family, but everybody is up, so you might hear some stomping around upstairs, and if it's distracting, my apologies. So, getting back to task here, I do want to get into releasing episodes, but at the same time, because I do have to, we're back to work and I'm busy back to work. People's dental problems didn't just go away. So I am going to be, I'm super swamped at work, and we're actually down a hygienist. I couldn't bring one of them back, and so we're dealing with a backlog there. And so, and a lot of pent-up demand. So busy at the office, and then of course being home, family is the most important thing. And also I'm getting back on focusing on my health. I've been maintaining, I didn't go off the rails or anything. It's not like I stress ate, or I just kind of maintained the last few months, and really that was kind of that's just what I needed to do for a few months. And I also stepped away from coaching at Keto Gains, not with them anymore, even though I'm still a huge supporter for them. And you know, they're my family, but at the same time, I didn't have the bandwidth to keep that going and give it the attention it deserves. So that's my personal update, but I'm back to it. As of this morning, I was 266, and my goal for the year was to get down to 220 or below, and I still think it's possible. So I'm back to a cut. Put my calories at about 1,800 calories, and protein centric, keto, you know. So for those interested with my macros, and I'm actually going to be this is going to be a 2-part episode today. And the second part is actually we're going to be talking about macros a bit. But my macros personally, because I'm very transparent about this stuff, is my total calories is set at 1,800 or so. And my total protein is set for 200, kind of one between 170 to 200, depending on if I'm training that day. And net carbs are at 30, and fat is set at 85. So yeah, that's about where I'm at as far as macros go, and tracking everything. And I'll let you know how it goes on, how it goes. So that's where I'm at personally, and I'm back to lifting 5 days a week, and I'm doing a lot of walking too. Kind of try to get over 30 minutes over my lunch hour. Then I try to get about 30 minutes either before or after dinner. So try to add another hour of walking a day as well, just for general movement and extra calorie burn. So, you know, follow along. It's going to be good. I'm feeling good, and we'll go from there. So, getting into today's topics, you know, for those of you who don't know, I'm a member of the Healthy Rebellion, Rob Wolf's little kind of distancing from social media thing. He created his own platform, and I love Rob. He's one of my heroes that has become a friend, and he started this thing, so I joined in, and I kind of help out over there, especially if somebody has any dental problems, any dental issues. And here's one that I wanted to share, because the problem is, and there's a few quote unquote functional dentists that spew a lot of pseudoscience. And there is some merit to what they say, but then they don't have the evidence for the grand claims that they're making. I don't think that the advice is inherently bad, and the risk is fairly low to do it, but they make it sound like if you follow their advice, if you get enough vitamin D, that all of your dental what ails you is going to be cured, and that's not necessarily the case. And as far as for you longtime listeners, the folks who have been following me through this whole thing, you know, I have one foot in like this ancestral health thing, but I have my other foot in kind of the evidence-based medicine thing. So I kind of look to see where those two meet, and where one side might be a little bit hyperinflated compared to the other. And so there's a lot of nuance in a lot of this stuff that I try to bring to the table, because there's a lot of people that are grandiose with their claims that I think spin a false narrative and unfortunately give false hope. And so I'm not trying to be a zealot or a guru here. I'm trying to bring practicality and nuance to the conversation. And so with that, Leslie in the Healthy Rebellion posted this, and I missed it because I've been busy, but somebody tagged me and brought it to my attention. So Leslie says, I feel like I've got all sorts of questions I want suggestions or answers for these days. Has anyone been successful at reversing or at least reducing dental problems? I've had a lifetime of dental work, multiple fillings in every tooth, root canals, and recently the loss of a front tooth, and the 2-year process for an implant and crown to make myself look human again. I wasn't keen on an implant, but I didn't want to look like a monster. Just when things have settled down, I've got another tooth to be threatening to be a problem. I have good oral hygiene, regular dental care, and good diet, but I have been blessed with a horrendous set of teeth. I have recently started to consider this to be an autoimmune issue as my body seems to want me to lose all of my teeth. I have had these dental issues since I was a child, and they seem to coincide with severe hair thinning at the same time. It's been close to 45 years and I'm getting really, really desperate as the pain that comes with each problem is beyond belief. Dentists have really not been helpful. They just joke about how I shouldn't eat so many sweets. Angry face. Any success stories or suggestions would be greatly appreciated. I want to keep my chompers as long as possible. Thanks for letting me vetch. So there's a lot of layers in this, and I'm a much better talker than I am typer. And so, Leslie, if you're listening, this is my response to you, because there's a lot of layers in this that we can't just keyboard warrior back. We have to have a conversation about this. And so I'm going to be doing a deep dive, and this is because, and I chose to talk about this because I see people every day. I talk to people online, and I see patients every day because I am a full-time practicing dentist. I don't just spend time on the interwebs. I really do this stuff for a living. And so I see this a lot, and people, rightly so, can get very frustrated with this. And I wholeheartedly agree and completely understand and sympathize with their frustrations. And so going back to her questions, let's take this one step at a time. I have had a lifetime of dental work, multiple fillings in every tooth, root canals, and most recently a loss of a front tooth and the 2-year process of an implant crown. Okay. So that right there sets us up for issues. Okay. If a tooth has been worked on previously, it is not going to be as strong as what nature had created it in the first place. We have great fixes. We have great patches. A filling is a patch, basically. You have a hole in your tire and you get a patch. Now, we see these things last for many years, sometimes as little as 5 years, sometimes as long as 30 years. There's a lot of factors that go into that. But prevention is key. That is why I'm so huge on prevention. That's why I'm huge on diet, low carbohydrate diet specifically, because low carbohydrate diets are more optimally as far as dental health goes, and I'm going to go into that more here in a little bit. But I'm so focused on prevention, the diet. Hygiene is good, but really we can't, like I say, we can't outbrush a bad diet. And so diet and prevention is huge. Mainly the dentists talk to you about sweets, right? Well, it's not just sweets. It's really any fermentable carbohydrates. It's breads, pastas, cakes, cookies, chips, all that stuff. High glycemic carbs like some fruits. and potatoes and stuff like that. So it's not just sweets. That kind of creates a false dichotomy. It's like carbohydrates are uniquely damaging dentally. They just are. And we can actually, we can go into a deeper dive on that with Weston A. Price's stuff, because he talks, Weston A. Price went and observed all of these indigenous cultures, all this stuff, these people on a primitive ancestral health diet and all that stuff, and they found way lower rates of caries compared to the standard American diet, right? Well, here's the thing. When you break his data down even more, as I have in for a presentation that I've put together dealing with ancestral health and anthropology and diet and all that stuff and dental disease, well, if you actually look at the places that he studied, and on the high end, you have the folks in the Swiss Alps that still had greatly reduced caries in comparison to the standard American diet, but they had the highest, versus the Eskimos that he studied had the lowest. What was the biggest common denominator between the biggest kind of contributing factor between those two? Was overall carbohydrate consumption. And the Eskimos ended up having like 150, or was it 150 times less cavities compared to the folks in the Swiss Alps. And so I have to re-look up those numbers. It's been a while since I've messed with the presentation. But it's ridiculously lower, and what the difference was ultimately carbohydrate consumption. So that is why if somebody is really is at a higher risk of dental disease, they need to be on a lower carbohydrate diet. And the higher your risk is, the lower your carbohydrates need to be for dental health. And I will argue that all day, any day. Some of these guys are talking about the gut microbiome and how show the data on that. You don't have the data on that. I do have the data on carbohydrates, okay? And so if we've had issues since we were a kid, and that could have been through malnutrition, that could have been through acidic, carbohydrate-rich diet, then we are set up for further issues down the line. It's like if you were in a car accident when you were 10 years old, and you broke most of the bones throughout your body, do you think you are primed to have more issues throughout your life than somebody who was never in an accident and never had a broken bone? Of course, right? You are inherently going to have more issues. That is why prevention is such a key. Now, that being said, that doesn't mean you are without personal power. That doesn't mean that there's no hope. It's just going to take a plan, and it's going to take realistic expectations. Okay? I take a drink of my coffee here. Hold on a second. Got some Black Rifle coffee. They're not a sponsor. I just really like it. Some Beyond Black is my favorite blend right now, by the way. So if you want to give that a taste, it's pretty awesome. So anyway, getting back to this. So if you've had issues your whole life and your teeth have already been worked on, they're inherently not going to be as strong as what a tooth that's never had a cavity, has never had to be prepared for restoration. So we have to take that into consideration, okay? And so let's talk about risk factors real quick. Well, when I deal with patients, I talk about the big four with risk factors. We look at gum and bone, because gum and bone is the foundation for everything. So what's the gums like? What's the bone like? That's where diet comes into huge play. Inflammation comes into a huge play. Yeah, obviously oral hygiene, blah, blah, blah. If we've had a bacterial issue going on, bacterial testing, DNA testing would be bacterial DNA testing, not like UME23 or whatever that is. I'm talking like actual bacterial testing might be indicative, might be warranted to take a look there. But then also the teeth. Are we at a high caries risk? There's a lot of stuff that goes into caries risk. There's diet, obviously. There are genetic factors that go into play. What's the buffering capacity of your saliva? What's the mineral capacity of your saliva? Even the texture of saliva and the quantity of saliva can play a role in its buffering capacity to wash away sugars and to neutralize acids. These all play a role. Then we look at the bite. I tell folks a balanced bite is crucial for long-term oral health. And it's just when things are in balance, when muscle forces are in balance, when the teeth are in balance with each other, then we're inherently going to have more wear and tear. I tell folks it's a lot like if you drive a car with the tires out of balance, what happens? You have premature wear and tear on the tread and the sidewalls and all that. The same thing goes with our teeth. They need to be in balance. The muscles need to be happy. The jaw joint needs to be happy. All that stuff has to play. And so when I'm talking with someone on the internet, I don't know what each of these situations are. And honestly, most dentists don't look at all this stuff either. We're not trained to do that in dental school. We're trained to kind of look at fires and put out that fire. But we're not really trained to view the whole stomatognathing system altogether. And so a dentist kind of has to take it upon themselves to do much more advanced training afterwards. And unfortunately, not all dentists decide to do that. And honestly, talking to patients, not all patients want to hear this stuff either. I talk to this about every patient, and a good 50-60% of them just kind of roll their eyes like I'm just making this stuff up. And so getting back to this, I don't know what each of these situations are like, but these are all things that have to be considered. Now, what do we do about it? Okay, so low carbohydrate diet. Lower the better, as long as we have adequate energy, blood sugar. I don't know if you're diabetic or if you have any conditions, so you can't take this as medical advice because I don't know what medications you're on and all of this stuff. But a well-formulated low carbohydrate diet that focuses on whole foods and nutrient density is going to be a must, okay? Really, I would recommend tracking stuff in chronometer, making sure you're getting all of your micronutrients well, making sure your electrolytes are on point, and then also be taking a look at vitamin D and vitamin K2, okay? Vitamin K2 is completely, it's underrepresented in its importance. Everybody's talking about vitamin D right now. Even with the COVID thing, they're showing that low vitamin D levels, you have much higher risk with complications with COVID. Well, the wonder twin that nobody talks about here is vitamin K2. If people need to be supplementing with vitamin D, they also need to be supplementing with vitamin K2 the vast majority of the time, okay? And vitamin K2 has also been shown to play a vital role in calcium and mineral sequestration. So basically taking it from the food, taking it from the blood, taking it from our digestive tract, whatever, and putting it where it needs to go, okay? And so vitamin D is great, but if we don't have adequate vitamin K2 to go along with it, then we might be spinning our wheels a bit, and we might actually be doing a little bit more harm than good. And so vitamin D, somebody suggested in the group to be looking at vitamin D. I would totally be on board with that as long as we're also getting adequate vitamin K2. Okay, so be looking at that. And it's a cheap supplement. It's like $7 for a month's worth. And you usually only get like these little 100 microgram tablets and stuff. And it's like $8 for 30 days. So, super cheap. Take it with your vitamin D. And then, so there is the nutrition side of things. Obviously, oral health or like hygiene is important, so make sure you're brushing. Get a water flosser. If you do not have one, get one. It is much more effective than manual flossing, okay? And then I really like the Carry-Free products. Now, it's going to depend on if you are against fluoride or not. The data does show that topical fluoride is a good thing. It's very protective, okay? Now, some people that are just totally adamant against fluoride, then what I would recommend would be to add brushing with a combination of baking soda with a little bit of xylitol, okay? Baking soda, the reason I like a brand called Carry-Free, C-A-R-I free, is because it has the fluoride, but it also has a high pH. It's sodium bicarbonate base, so it's a very high pH to help neutralize acid. And it has nanohydroxyapatite, which helps feed an apatite structure to the tooth structure to help remineralize it, make it strong again. So it's not only getting the fluoride, but it's getting the high pH, it's getting the nanohydroxyapatite, and it's also sweetened with xylitol. Xylitol, for those of you who don't know, is a natural sweetener, and it's toxic to dogs, but other than that, for us humans, it's fine. And it is bacteriostatic, meaning the bacteria eat it like a sugar, but they can't metabolize it. If they can't metabolize it, they can't grow, they can't reproduce, and they can't excrete acid. So that's why xylitol is very good for dental health. And so I would be looking at the Carry-Free products, the gels, and they have a mouth rinse. I'd be using both of those. If you're not going to want to do fluoride, Carry-Free does have a Fluoride Free Gel. It's their CTX3 gel, and I actually use that with Hazel. And she gets grape flavored, and so you could do a fluoride free if that's what you want. Be looking at that. And then as far as a rinse goes, you could do something like take some distilled water, add some baking soda, add some xylitol. You could even add maybe a few essential oils like peppermint or spearmint or something if you wanted. But you could rinse with that, because really the high pH is what's going to be the best thing there to help neutralize acid. Okay, then I don't know what your bite's like, so that's something to take into consideration. I do a lot of orthodontics. I do early interceptive orthodontics for kids. I do airway management for kids and adults. I do myofunctional therapy for kids and adults. And the number one reason that I do adult orthodontics is actually for bite stability. Yes, their teeth end up looking straighter and better and all that stuff, but I come at it from a aspect of health. And if teeth are in a better position, they're going to have better, they're going to be if they're easier to clean, they're going to be at a lower risk. If they're working and functioning the way that they should, they're going to be at a lower risk for breakage. If they're inclined properly, taking the proper forces and all that stuff, the foundation, the gum and bone is going to be healthier. So these are all things that we have to consider. And, if you're having issues finding a dentist that takes this stuff into consideration, then message me, let me know your location, and I can try to find someone. Unfortunately, we're a rare breed. I hate to say that. It seems like I'm putting throwing dentists under the bus, and I'm really not. The vast majority are good. It's just trying to find people who take a comprehensive approach to all this can be maddening. And sometimes I wish I'm in a little town of 1,400 people. Granted, I have people that drive an hour or two to come see me for this comprehensive care, but I kind of wish sometimes I was in a more metropolitan area where, a dense area where maybe I would be a little bit more accessible for people. But try to find someone. If you can't find someone, reach out to me. Maybe we can even do a little bit of a consult, like over Zoom or something. I'd be happy to try to help folks out. But yeah, nutrient-dense, low-carbohydrate diet. The lower carb, the better. The products that I was talking about at home, baking soda or xylitol, or you can look at the carry-free products. It's probably my favorite thing. The water pick would be awesome. If your bites go, wonky, getting things taken care of with orthodontics. If you have a deep bite, so our front teeth should overlap about 20%. If they're overlapped 50% or more, that's going to lead to further wear and tear. That's also very highly correlated with sleep-disordered breathing or sleep apnea. And so these are all things that, if someone clenches or grinds their teeth, there's about 70 to 80% that they have some sort of sleep-disordered breathing or some level of sleep apnea. So that's another thing that we have to take into consideration, okay? So there are some xylitol mints and gums that could help. My favorite brand is called Zellies, Zellies. They make some good mints and gums. If you have a lot of wear and tear on your teeth, maybe stick to more of the mints and less of the gums. So there's that. Icebreakers, ice cube gum is good. That's readily available anywhere, and it has a good xylitol concentration. So you can get that about anywhere. So Zellies, I usually get those online or at a health food store. But I hope that helps. Don't lose hope. It's just we've really got to get you hooked up with someone that is going to look at each of these things that I talked about. Yeah, aesthetics is great, but we got to look at airway. We got to look at the bite or the occlusion. We have to look at our structural risk, our teeth developing cracks and stuff like that. Are we at a high caries risk? We have to look at the gum and bone and all of that stuff. You have to look at all of these things, or else we're just going to be patching stuff, and we're just constantly going to be on this treadmill. It's like when I tell patients, I don't care if it takes 4 months or 4 years. I just want to know, where are we at? Where do we want to go? And how are we going to get there? Because whatever we do, I want to make it to where we get people off of this treadmill. Okay? And so that's what I want for you. I hope this helps. Like I said, I'm willing to have more of a conversation with it, but obviously this is way too much to type out. So that is why I brought it up here on this program. Okay. So Leslie, if you're listening to this, let's talk some more. Maybe jump on a Zoom call or something. We'll get you hooked up. Okay. Oh, so speaking of that, anybody who has questions, message me on social media. I'm on Instagram at Ketodontist. You can email me, ketodontist@gmail.com. You can find me on Facebook. If you're into Healthy Rebellion, message me there, whatever. But, as time allows, I'd be happy to help. Okay, and so the second part of this discussion today is actually going to be about setting up your diet and setting up macros and all of that stuff. So I've gotten back on a kick of getting back on track, focusing on myself. For me, exercise and diet, that's my medicine. Those are my drugs. Okay? Dealing with anxiety and stress and depression over these last few months and everything, I have refocused on exercise because that is my antidepressant, basically. And so I let it out to people locally that I'm going through a kind of a 90-day reset, and I asked if people wanted to join me. And so people have, but I've been getting a lot of questions about, well, how do I set up my diet? Do I have to go keto? All that stuff. And so I wanted to spend some time today talking exactly about that. So first off, let's talk about keto versus low carb. I truly believe that everybody should go keto once in a while. Does everybody have to stay keto for the rest of their life? No. Do we have to chase ketones? No. Unless if you're doing a therapeutic ketogenic diet for some sort of cancer adjunct therapy, prevention, epilepsy treatment, whatever, then that's one thing. But 95% of the people wanting to do a ketogenic diet is for weight loss or reduce inflammation or whatever. And so that's the group that I'm going to speak to. And I truly do believe that people should follow a cyclic ketogenic diet. Now, is that keto 80% of the time and coming out of keto 20% of the time? Is it 50-50? Is it a few weeks or months of keto out of the year and the rest of the year is low carb? I don't quite care. That's going to be very dependent on your situation. But going keto for pretty much anyone would help them realize a lot of things. It's going to not only help fat adaptation. I think that's huge. Metabolic flexibility, I think, is important for about anybody. But it also kind of resets our palate. It helps reset our taste for food. It helps us get in tune with ourselves. I truly do believe that. And then there are some people like myself that are just inherently going to be better on a ketogenic diet for longer. Some people, though, they may want to dip into keto for 4, 6, 8 weeks, whatever, and then maybe go to more of a low carbohydrate diet instead. It really doesn't matter. That's going to be your personal preference. That being said, I think carbs are pretty dang overrated. I really don't see the vast majority of people needing to consume more than 100 grams of carbs a day, or 150. 150 would be the upper echelon, and that would be for people who are just hitting the gym hard, your bodybuilding crowd, your endurance athlete crowds, and all that stuff. Those people, yeah, if you have a huge energy expenditure, and you're doing intense physical loads, then yeah, maybe up to upwards of 150 grams of carbs a day or so would be beneficial. But the vast majority of people, of the population, should really be under 100 or less. I truly do believe that. That's kind of like the starting point for me. Do you want to go keto? Okay, you don't want to go keto? Okay, don't go keto, but go low carb. Because what's the standard American diet? The standard American eats 300 grams of carbs a day is the figure that sticks out in my mind. So even just dropping that by 2/3, just even going to 1/3 of that, as long as we're focusing on whole nutrient dense foods, that's going to be a huge boost. Okay. And so I don't care if you go keto or if you go low carb, but just remove all the junk, So when I ask folks, what are their goals? Are you trying to lose tons of weight? Are you really wanting to go on this whole hog? If you're wanting to go on this whole hog, jump into keto. Just do it. We're going to help you make sure that it's structured properly, but for the vast majority of people, if you're doing it right, there's no real inherent risk as long as you're getting adequate calories, adequate protein, adequate electrolytes. Okay? And so let's talk about those. First off with calories. How do you calculate your calories? My favorite way for most people is just using the Ketogains macro calculator. I think they have a great calculator over there. They've redesigned it recently to where it's very slick. Are you a man or woman? Are you, height, weight, body fat percentage if you know it. And because a lot of the online calculators, they have too high of a BMR setting, in my opinion. I've seen a lot of people use online calculators and they're looking at the BMR, the basal metabolic rate. That is your metabolism. If you laid in bed all day, didn't move a single muscle, how many calories does it take to keep you maintained? That's your basal metabolic rate. Then we talk about TDEE, your total daily energy expenditure. So that's your BMR plus calories through activity. Calories from physical work that you're doing, standing, walking, moving your hands gesturally as you podcast, all of this stuff, all the calories burned above your BMR. If you're trying to lose weight, set that to sedentary. No matter what calculator you do, I don't care how much you think you work out or how many calories you think you burn. If you're trying to lose weight, set it to sedentary. Okay? So my TDEE is about 2,300 calories. Okay? So to be in about a 20 to 25% deficit, that's why I put my calories at 1,800. Okay? Well, here's the thing. I get a lot of people who I make this recommendation to, and they decide not to go through with it because they look at what the calorie calculator says, and they're like, oh, that's too low of calories. That's too low of calories. I'll go in starvation mode. Because it's recommending that this person eat 1,400 calories a day to lose weight at a 25% deficit. And that's when we have to get realistic about ourselves. So if you're as a woman, over 30% body fat, you do not need as many calories as you think you may need. You just don't. I did a workup here lately where the person was over 50% body fat, and I'm not judging because I was over 50% body fat as a man, and women tend to shoot higher, about 10% higher than averages for men. So if for me, any man over 20% body fat really should be focusing on fat loss. Well, for women that would be 30. 15% for men is a great maintenance. For women, it'd be 25, so on and so forth. Anyways, so to put her at a calorie deficit, she needed to consume about 1,400 calories a day. Well, how? Okay, fat is not energy expensive. It's very energy static. So it does not boost our metabolism. It is very metabolically inert. And so most of our metabolism is going to be based off of organ function and lean body mass. Okay, the more lean body mass that we have, the higher our metabolism. Carrying an extra 20, 50, 100 pounds of fat mass isn't really going to add much to our resting metabolism. Okay? And so we have to think about our calories based off of our lean body mass. Just because someone weighs 300 pounds doesn't mean that their TDEE is 3,000 or 3,200 calories. It's closer to 2,300 calories, okay? And so if we're reducing calories, then our macronutrition and our micronutrition becomes a lot more important, because think of your calories as a budget. You think of it as money. I have X amount of money to spend. Do I want to spend it on junk at the dollar store, or do I want to spend it on my essentials, my needs? Okay. Well, it's the same thing with calories here. Okay, if the reality is I only have 1,400 calories that I can eat in order to fulfill my goals. I want them to be the best source of calories that they can possibly be. This is my exact beef with the if it fits your macros crowd, because they talk about, oh, it doesn't matter what you eat as long as it fits your macros. Bullcrap. Absolute bullcrap. Micronutrition is going to be huge. Yes, people can lose weight on a Twinkie diet for 3 weeks, whatever. Show me 3 months, 6 months, 3 years on that. We're going to have some problems. Okay, so if you're reducing calories, you have to focus on your micronutrition. Okay, so get enough protein. Sorry, keto zealots who think protein will kick you out of ketosis. I don't care. Getting kicked out of ketosis versus losing lean body mass, I am going to focus on lean body mass. That is just how it is. High protein diets are universally favored in the scientific literature. They just are. It's pretty much irrefutable at this point, okay? So focus on getting adequate protein. I would focus on about a gram of protein per pound of lean body mass. Now, if you're using the Keto Gains macro calculator, it's going to automatically do this for you. But make sure you're getting adequate protein. So for this person, I set her on 140 grams of protein. Okay, and then keep your for keto, keep your net carbs between 20 to 30, and choose your carbs wisely. Keep them to nutrient-dense whole foods. Basically, tons of vegetables, man. Green and leafy vegetables, low-carb vegetables. My favorites are asparagus, broccoli, cabbage, or coleslaw mix. I love using coleslaw mix and doing like an stir-fry egg roll in a bowl thing. Let's see, cauliflower, Brussels sprouts, spinach, lots of zucchini. I do tons of zucchini. Mushrooms, maybe a little bit of tomatoes, some onions in moderation, some bell peppers or red peppers in moderation, stuff like that. Load up on that stuff. Lettuce, make a salad. You can have a huge salad. And this is what allows you to have huge nutrient-dense meals that are filling, that are tasty, that deliver all the stuff that we need, and do so on less calories. At 1,800 calories, I eat almost 2 to 2.5 pounds of food a day, and yet am under 1,800 calories. And so if you structure it correctly and you focus on whole nutrient-dense foods, it can be very healthy, very satiating, very tasty, while still being at the calories that you need to be at. And then you fill in the gaps with fat. So depending on how what your calories are like, will determine how much fat that you can have. So, and I eat the same foods every day. I eat the same meals every day. Now, if I'm maintaining, I can have fattier cuts of meat. I can have more butter or stuff like that. More full-fat cheeses, whatever. But if I'm trying to lose weight, then I go with leaner portions of protein. I go with lower fat sources of cheese, or I use cooking spray or whatever, like avocado or coconut oil spray, and I'm not using a lot of oil. I'm using more nonstick surface stuff. But that's how I would recommend getting that set up. Go over to the Keto Gains macro calculator, or if you just want to focus on, not focusing on calories, then just focus on nutrient density. Keep your total net carbs under 20 to 30 grams of carbs a day, and get enough protein. Shoot for a good starting point is about 1 gram per pound of lean body mass. That's a great way to start, but I'm kind of a rip the Band-Aid off kind of guy. Just start tracking. Just start tracking. And if you have questions on that, I can do that in a deeper dive later. But I'm already almost to 50 minutes here, so I'm going to wrap up. Gang, thank you so much for tuning in today. I really appreciate it. Again, I apologize for being gone for so long, but I'm getting back into the saddle. We're going to be talking a lot about kind of a new passion of mine, and that is airway, that is nasal breathing, that is interceptive orthodontics, myofunctional therapy. There's a lot of ground to cover. Coming up, the oral systemic health connection. There's been so much that I've been diving into lately that I want to share with you guys. But there's also the lifestyle, there's the training, all of this stuff, the sleep, everything. So stay tuned, lining up a lot of good content and lining up some good guests that's going to be exciting, that you may have heard before. Some folks you may not have heard before, but they're going to knock your hair back, and it's going to be great. So if you enjoyed today's show, please share it, subscribe to it, leave us a review. If you could leave us 5 stars or leave us a review, that would be absolutely huge to help spread the message in this kind of this ancestral health but evidence-backed, science-based ancestral health model that I think the vast majority of the world could benefit from, and it's just not being talked about. So until then, guys, you guys take care. Make sure to eat, make sure to move, make sure to smile, and I will talk to you later. Take care.